Arthritis is one of the most common problems you'll come across, and everybody's got family members or friends who've dealt with arthritis of different joints, and that's sort of the age-related change and wearing out of these joints which we walk on and play sports with all the time. So one of the most common ways to treat arthritis is actually resect the arthritic joint, and some of the joint replacements that I do specifically would be knee replacement surgery as well as shoulder replacement surgery. So knee replacement surgery involves removing the arthritic portion of the joint through an incision in the front of the knee. So in a knee replacement, an incision is made in the front of the knee, and the kneecap is moved to the side, and then this is the worn portion of the femur as well as the worn portion of the tibia is then resected, and those are replaced with metal and plastic spacers inserted as well to alleviate that arthritic condition. Similarly, in the shoulder, an incision is made from the tip of this bone here, the coracoid process, down to about the mid-arm, and then the large deltoid muscle is reflected, and the diseased portion of the proximal humerus as well as the glenoid are then resected and replaced with metal on the humeral side and a polyethylene glenoid, taking care to preserve the rotator cuff which attaches out here to the lateral portion of the proximal humerus. That is then closed and the procedure is complete. So here at Platte Valley Medical Center we do offer what we've termed the Total Joint University, which helps give patients a better understanding of what to expect.
So Total Joint University is a class that we offer at Platte Valley Medical Center the second Tuesday of every month. And it's just an informational class that educates patients on what to expect before, during, and after a total joint replacement surgery. We have someone from surgery department come in and she'll talk about what to expect during the surgery process as far as anesthesia, prep time, what to expect after you're done with surgery, medications, things like that. And then we have the nursing department talk for a while, and they talk about what to expect while you're in recovery at Platte Valley. So they'll talk about pain levels, pain management, who you'll be seeing, how they're going to check to make sure that they've got the right patient, how to get information to and from your nurse and your doctor appropriately. And then we have the care team come and talk, and they talk about what to expect as far as insurance is concerned and what to do prior to your surgery to make sure that you are prepared for the financial concerns, and also as far as medications are concerned, durable medical equipment, all those sort of hidden costs that people don't really think about before they go in for the surgery. Final part includes the physical therapist who comes and talks about what to expect during the therapy process while you're in the hospital, including how many times a day, how many times a week, what kind of exercises you'll be doing, where you'll be doing the exercises, the pain management as far as that's concerned, and then what to expect as far as after discharge from the hospital, where you'll be going, if it's rehab potentially, or if it's to home with home health care. And then we talk about outpatient physical therapy ultimately down the line, with the ultimate goal to be discharged from outpatient physical therapy with, decent strength, range of motion, and the ability to walk without an assistive device if that's the goal, or to walk without as much assistance.